Today we're going to be talking to Tina Lynn about our CT. That's a cool diagnostic tool we have over at our Lincoln location. So Tina, what is a CT scan?
Oh yeah, so it's a series of images that we get, kind of like an x-ray, but you're actually getting over 3,000 images as the machine rotates around your pet. It then compiles those images all together, so we're getting a full image of everything inside your pet. It's a really cool diagnostic tool that we've had for almost 2 years now and found some great benefits to it.
That's awesome. What situations can a CT scan be used for?
Oh gosh. So one of my favorites is for skulls, like kitty cats that have chronic upper respiratory issues, ear issues. We can actually see deep inside into that middle ear canal and pass to see what actually is there. If there's a lesion, a polyp, if it's an infection, just gives us a better diagnosis. We use it also for any masses. If there's something in the abdomen, we can actually do some surgical planning based off of what we're seeing and have a better idea before doctor goes in for surgery.
Wow, that's awesome. How is a CT scan performed on a pet?
Yeah, so if anybody's had a CT themselves, I've had the pleasure myself, and you just lay on the table. It says hold your breath 1, 2, 3, and the machine rotates around you. Unfortunately, our pets aren't comfortable or able to compensate with my 1, 2, 3, hold your breath. So we have to put them under full anesthesia, and I actually hold their breath for them. We have a technique called a breath hold as I'm doing their anesthetic, where I hold their breath, the machine rotates around, and then we get the images. Typically what happens is your pet stays with me for about 2 to 3 hours. We do a little prep work ahead of time, IV catheter, fluids, we get them sleepy, we do the scan. The scan itself typically takes me anywhere from 5 minutes to 20 minutes, just depending on how many areas we're scanning. And then they have to be on IV fluids for about an hour after the scan because we inject contrast to highlight anything we want to look at. And then typically they go home right after that. Most people just let me know that either they're a little sleepy after or they might have to urinate a little bit more just from the IV fluids. But most people report their pets go home without any after effects whatsoever.
How quickly do we normally get results from these CT scans?
Yeah, so typically we send them off to a radiologist board certified that reads these for us. If it's something simple like we're actually scanning your pet's mouth as we're doing a dental or a core procedure, that doctor will look at right there in house and have results for us then and decide what's the best plan of action. If we're doing something more extensive though, we send those off, and typically it takes 2 to 3 days to get the radiologist report back.
Okay. And the last most commonly asked question about CTs, how do I get my pet ready for a CT scan appointment?
Yeah, so most of the time it's as simple as withholding food for 12 hours, water's fine the morning of. Now, if we are scanning the abdomen and we're either looking at like kidneys, bladder, anything in the gut, they do like an empty gut. So sometimes we do have to give an enema to kind of get everything cleaned out. But for the most part, there's really not any different prep than what you would do for a surgery of withholding food.
Perfect. All right. Well, thank you very much, Tina.
Thank you.